So, hi guys, good day. I am Dr. Sergi Diloso and I'm one of the vets of Diloso Veterinary Clinic. So, may patient tayo ngayon, si Happy. So, yan, si Happy masaya na siya. Basically, Happy was my patient 1 month ago. So, problema niya, meron siyang radioulnar fracture. So, he was referred from another veterinary clinic. And sadly, nag-fail yung fracture. So, nagkaroon siya ng draining tract. Ibig sabihin, may infection. And then nagkaroon ng osteolysis at pagkasira ng buto doon sa surgical area. So what I did was, dahil medyo grabe yung kanyang dermatitis, and grabe rin yung draining tract, so we have to manage yung wound. So we have to give some antibiotics for the next 2 weeks until medyo nag-subside yung inflammation and yung discharge doon sa kanyang surgical site. So ever since na-surgery siya, that was 3 months ago, hindi siya nakakapaglakad. So we did the surgery 2 weeks, so it was a two surgical procedure at one time. So we have to collect bone graft dun sa kanyang pelvis. Kaya kung makikita nyo siya, dalawa yung kanyang So we have to collect bone graft from sa pelvic bone niya, and then we have to transfer it dun sa kanyang radioulnar fracture. So the first surgery rin dun sa kanyang radioulnar was to remove or explantation and debride and remove some of those infected tissues and bones. So after that, we had another set of instruments for implantation and placement ng bone graft. So ayan, so 2 weeks pa lang. Ayan, 1 week pa lang. Actually, a few days after surgery, the owner reported that he was already using the leg. And right now, ayan, nakakapaglakad na siya. So, the owner was also amazed, kasi ever since operation during his first procedure, he was not able to bear weight from that affected leg. Right now, 2 weeks pa lang after surgery, naglalakad na siya. So, it was a big improvement. So ano pa siya? Galing pa siyang Tarlac actually. Ayan, so at least, it was actually recommended for for amputation. So with the help of good surgical planning, appropriate instrumentation, and then application ng principles ng orthopedic. Okay? So it's very important na nagpo-focus din tayo sa biology. So importante na nabigyan siya ng bone graft, and likewise nag-focus tayo sa biology and proper instrumentation and planning. So ayun. So at least okay na siya, and we will see her again, I think, for the next 2 months. Follow up lang ng x-ray niya. Okay? So again, I'm Dr. Sergi Diloso, and thank you for listening.